Some people just believe, let us take herbs, let us pray about it, everything is going to be all right, rather than accessing those health services that are available for us. But then they are also limited by that finances. And then the proximity of where they are staying to the health facility is also another challenge. Looking at the northern region of Nigeria, when you are traveling to the rural communities, they are a kind of sandy. You understand? And sometimes if you are on bike, you can imagine there are some areas that vehicles cannot go to. And then when you want to take a bike and then the road is slippery, is sandy, you can imagine carrying a pregnant woman on a bike trying to travel how many miles to the hospital for her to access health services. It's going to be a really difficult challenge. So sometimes the husband will even prefer to say, stay at home. My mother gave birth to me at home. Why don't you also give birth to my children at home? And before you know it, she might lose her life or the child might even die. So those are some of the things that we face in northern Nigeria, even though over time the narratives are changing. But the narratives are changing mostly in the cities. What happens to people in the rural communities? What happens to people that are living in hard to reach areas? So those are pressing challenges. Sometimes when we are trying to estimate the number of maternal deaths, we just do it on the surface, because when we go deep down into the communities, in the rural areas, those are places where these real things happen and nothing is being done about it day in, day out. It is really something that we really need to talk about, and we really need to address it.
It looks very gloomy, actually. It's not beautiful. It's not nice in the eyes at all. Especially when you were making reference to a particular case just now where a woman is in labor, she needed to be attended to in the hospital. Instead, some people decide they want to perform some rituals, some religious rite, which eventually led to her death. And then we have this web of poverty, and is it coupled with illiteracy? I don't, it's heartbroken, a part of it.
Yeah, so they are a kind of and these things are being caused by a lot of factors. We have ignorance, we have poverty, and then we have the religious aspect. And you can't just fight one and leave the other. All of them, they need to be addressed. You understand? Like for instance, now in one of the interventions that we had, what we did was supposed to have a discussion with the men. Why is it that you don't allow your women to access these health facilities? Is it that women don't die in your community? And they said, yes, women die due childbirth. Do you know that this death can be prevented? They said they don't know. And then you, as the person that is knowledgeable about this, you now, okay, educate them. And then they now said, okay, what are your challenges? Why is it that you don't allow your women to come to the health facilities? And then they start to mention it. Oh, the facility is far away from us. Oh, we don't have the money to pay for the hospital bills. Oh, we are not even aware that something like this can be prevented. All we thought is that since our mothers used to give birth at home, we too, we need to do that. And that is why sometimes when you see donors coming to support the country in this kind of interventions, after the donors have funded it, the donor funding is limited. What happens thereafter? How does the country sustain such kind of interventions?
All
Yes, there
right.
are some people, they just feel, and when you are not feeling fine, there's one leaf you need to go and cut and then just drink the water and then you'll be okay. It might work for one, it might not work for another. But then we need to create awareness about the need for us to access these healthcare services, and we need to talk to our religious leaders to be able to ensure that women access antenatal and postnatal services. It is very, very important.
All right. Now we have two issues now that we are looking into. One is that there are few facility that are in some places not reachable. And the second is that there are people who are not yet enlightened enough to understand that they need to use even these facilities that are available today, even though they might be limited. So let's try to understand the part that we can say maybe is ignorance, because the people don't know that they should give birth in the hospital, instead of giving birth at home. Of course, I'm not saying that giving birth at home is something wrong. Me, I was born at home. All of us who we were born at home. My mother gave birth to 9 children. All of us are alive. No, I'm not saying that giving birth at home is something that is completely wrong. No, of course, you need to know what you are doing for you to do that. I'm not saying that you cannot use traditional herb. Only that you need to know what you are doing. It's not, don't do what you don't know. That is risky. Okay, now, um, tell me about this sensitization program that you guys are into to help the people understand. Because I want to believe that there is a state government in this area. I want to believe that there is local government in this area. I want to believe that there are programs in this area which the federal government of Nigeria is paying for to help the people understand. Since I have been a child in Nigeria, there have been program of letting people know of how to go about childbearing. It's not something new. So tell me what is being done to help the people understand of how to take care of their pregnant women to give birth, before they give birth, after they give birth, and how to rear the children. Help me with that.
Okay, so before I come to that, it is not that people are not aware, because there have been a lot of programs, a lot of jingles that have been made, both in Hausa, in English, in Igbo, in Yoruba, that they play. And you know, people in these rural communities, despite the fact that they don't have access to television, they have access to radio, so they listen to this. But the truth is that what limits them from accessing these healthcare services is, one, distance from the healthcare facilities, two, lack of manpower. Even in those facilities that you say, okay, there are facilities in so places, when you go, maybe you might not even meet a healthcare provider. What the third thing is finance. They don't have the money to pay for all those healthcare services. So sometimes when you're telling somebody go to the hospital, the person might try to tell you, where will I get the money to pay for it? Like, for instance, now, for you to prevent all these maternal and neonatal deaths, you need to, as a woman, when you are pregnant, you need to start going for antenatal care in the first 3 months. And then when you go to the hospital, they are calling thousands of naira for you, 6,000 and above, for you to register. So a woman in the rural community afford such kind of money? She will be first to say, I will stay at home. What happens, happens. I will take care of my baby. After all, so woman did, and she gave birth successfully. So that money, sometimes it limits them, and sometimes the attitude of healthcare providers. And then when there are no adequate manpower in the facility, sometimes you can travel miles and then you come to the facility and they tell you there is no nurse, or there is no doctor, there is nobody to attend to you. Next time, you might not even feel motivated to want to come. And then the money they are charging you is another thing. These people don't have enough money. Instead of you to provide these services for them at a low cost or even free of service. And that is why I'm so passionate about this universal health coverage. When we are talking about health insurance, there are some women that they don't even have self-delivery. They will have to be operated upon. How much will you ask them to pay? What if they don't have that amount of money? They are being neglected. Go and look for it. And then the man goes to sell all his assets, and then at the end, before he even comes back, the woman might even lose her life. So how can the government help us to subsidize this? Because if it is affordable, these people from this, it won't be difficult for them to come. They will come by themselves. It's not that they are not aware of it. There are so many sensitization programs that have been going on, sometimes even by the government or by donor and non-governmental organizations. They bring in maybe the district health, they bring in healthcare providers, they bring them, they sensitize them about all these things. But how about the out of pocket spending? How about what you are going to spend just for you to access that service? Last month, I was in a community. I was trying to interview a woman for something different. And then she started telling me, can you imagine me? I'm just a petty trader. And then I went to give birth in the hospital. They had to do CS for me. I spent over 100,000 naira. So you can imagine what she went through. She was pained and she felt, okay, maybe since I am coming from the health sector, I was going to bring in something for her. And all I could encourage her was, it's good for her to register into the health insurance. The health insurance, at least it will help in reducing the load of the money that you are going to pay. And then when I first threw the question to her, okay, health insurance is just 13,500. She said, why would she see that kind of money? So how can the government help us to subsidize something that can help the poor masses? Because every policies that are being made by the government are something that it is only the rich that can afford it. You can imagine the number of unemployed youths in the society today. So if I don't have 13,500, I cannot access healthcare services. What happens to the market woman? What happens to the poor people in the community? How can they be able to raise such an amount of money just for them to access healthcare at a subsidized rate? Yes, health insurance is very important. There was a time I was sick, and because I was under health insurance, I went to the hospital, and after all the tests, the injections, the treatment, they just collected 450 naira, which is very good. But for somebody that is in that rural community, how can the person be able to raise such an amount of money? And that is why when they are even sick, they don't bother to go to the hospital, because they tell you that, well, if I go, they are going to charge me a huge amount of money. And if you try to introduce this health insurance to them, they say, where would they get such amount of money to be able to pay? So
All
what
right.
can the government do to subsidize this for them?